My name is Dr. Sylvia Aradi, as I've been introduced already. I'm an internal medicine specialist and a lecturer in the Department of Internal Medicine, Maseno University. So we conducted a study among our students, and basically we were trying to find the competency in electrocardiogram interpretation among 6th-year students in Maseno University. So just as a form of introduction, electrocardiogram, which we commonly refer to as ECG, and I think in the US they talk of EKG, which is basically the same thing. So it is a very important diagnostic tool that is important in cardiovascular medicine. And I want to believe that all of us have had some form of interaction with ECG, either as the clinician or as the patient. And when you're the patient, the only hope you're having is that whoever is conducting the ECG on you actually knows how to interpret it and knows what they're doing. So that is what was our major aim here. So it's important in diagnostics, and it's a good interpretation of ECG. Actually, it can be very, very life-saving because there are some conditions that require us to act immediately, and poor interpretation actually leads to very bad cardiovascular outcomes in patients. And therefore it's very, very important that our medical students, graduating medical students for that matter, at least are able to know what are the major cardiovascular and ECG abnormalities. The objective of our study was to evaluate the competency of ECG interpretation among 6th-year undergraduate medical students in Maseno University. And basically what we used was one-arm pre-test and post-test quasi-experimental study. What we did is that we had 20 major abnormalities as well as a normal ECG for the patients, for the students. And what we were basically doing is that we had a pre-test that was done almost 2 months before the students got formal cardiology lectures. And it's in the cardiology lectures that we really emphasized on the importance of proper interpretation of the ECG. So the questions were administered to the students, as I mentioned before, the cardiology lectures, and during the post-test, the questions were shuffled. So SPSS version 25 was used, and basically we were using the paired T as well as descriptive statistics for analysis of the data. So the results that we found, the 6th-year students, there were 61 students that participated in the study, and the pre-test performance was at 58.11%, and after the teaching, the post-test was at 74%. Among the ones that were very well identified was ST elevation myocardial infarction. For those who might not be familiar with this, this is what we commonly describe as a heart attack, which is a medical emergency. And what we saw is that the mean was at around 90.2% at pre-test and actually 96.7% post-test. So it's safe to say that we have safe doctors who can at least be able to recognize a heart attack, the ones who are graduating at least. So we had a decline in performance in one of the abnormalities. It's called left bundle branch block. As you can see, the pre-test was also just as badly done, but the post-test was actually done worse. So that poses a challenge on us as the ones who are teaching. But it's important to mention that left bundle branch block, even for the clinicians, is normally a nightmare in how to diagnose it. So maybe we need to put more emphasis on this. So there was a positive correlation that was significant, and basically what it implied is that the ones who had very bad or rather low scores in the pre-test did quite well significantly in the post-test, and the p-value was actually at 0.0001, which was very, very statistically significant. So this is just to show you some of the abnormalities of ECG that we saw. We are happy that at least they are able to recognize a normal ECG at 100% in the post-test, but they were not doing too badly even in the pre-test. And the myocardial infarction, as you can see there, the pre-test was at 90% and it improved to 96% post-test. Atrial fibrillation is the commonest cardiac arrhythmia. So we were happy that at least our students are able to recognize it, especially post-test. As I already mentioned, left bundle branch block was done scored very poorly, and actually the post-test was even less. So it's worth noting that most of these conditions are the ones that actually require intervention at diagnosis. So it's very good that they were able to recognize these at this point. So these are the other ECG patterns. And what I just want us to appreciate is that there was a significant improvement in most of them, from the pre-test to the post-test. And especially what we call shockable rhythms, at least they are recognizing them very fast. So it's safe to say that at least there is hope that they're going to make very good doctors in the future. So on to the discussion. So the findings, what they showed is that the pre-test had a relatively good performance, which was average performance, and above average performance for the post-test. And we are alluding the good results in the pre-test to they normally get these emergency medicine lectures in the 5th year. So that's when they get this introduction to ECG, where they are taught now, their focus is more on emergency medicine. So like myocardial infarction, hyperkalemia, to mention just a few, are definitely taught during emergency medicine. So by that time, they already are aware of some of these conditions, and that may explain their relatively good performance, even in the pre-test and more so in the post-test. So our study actually had inconsistent results compared to other studies that were done in the region, where they actually found suboptimal performances in most of the ECG interpretations. I'll just mention a study locally that was done in 2018 in the University of Nairobi, where they did a similar test, and actually post-test, they found the results to be at 32% mean performance. So that was actually lower than what we see here. And actually global studies have also been done, and what they've shown is that there is relatively low overall competence in the interpretation of EKGs world over. So as I mentioned, that the good performances that we attributed was in the pre-test was because of the emergency medicine training that they get. And actually the hypothesis that we have alluded to is consistent with a study that was done that showed that when you increase exposure to ECG, you actually improve outcome. So that they were introduced to ECG in 5th year, then in 6th year during didactic lectures, and when they were in the wards, we were insisting on ECG, may likely be the reason for the good performances, both pre and post-test. So the approach that we used for teaching this particular, in this study, was a summative teaching, to a summative approach in the assessment of the ECG interpretation. But actually, studies have shown, as far as ECG interpretation is concerned, we do not really have a standard way of teaching. We do not have a medical pedagogy that is superior as far as ECG is concerned. However, what it has shown is that student-targeted and formative teachings have had worse outcomes compared to others like summative. So maybe we should change the narrative that maybe we should go the summative way. It may be more impactful. So the limitation for this study, it was a one-arm study. It was a one-arm pre-test, so we are not really able to authoritatively say that the post-test is the one that really gave the intervention we did is the one that showed the positive outcomes. So maybe if we had a comparative arm, then it should be a stronger study in that regard. So in conclusion, what we found is that among our 6th-year medical students, there was a statistically significant improvement in ECG interpretation after a formal ECG training that they did. And that we can say that our students are quite competent as far as ECG interpretation is concerned, and that a competency in ECG is a very critical and crucial part in a diagnostics, and therefore should be taken with a lot of seriousness because of the way it impacts on patient care. So we would recommend a two-arm approach where we have one arm on one side that does not get the intervention maybe, and then the other one gets, and then we see how that how that will be interpreted and see if it will have positive impact. And another important thing is to facilitate better ECG interpretation skills. We may need to consider having repetitive teachings, not just in ECG, but most of our training, because that is in medicine you can't have just one exposure to something. So frequent exposures lead to better outcome. So I think that should be my last slide. Thank you for your time.